We will be talking about obsessive-compulsive disorder, with Karen Rousseau as our example. Part 3. Conceptualization and treatment. Now we talk about Karen's case: conceptualization and treatment. The therapist saw the ritualistic behavior as one part of Karen's overall difficult situation. Karen's counting compulsion represented her attempt to reintroduce a sense of personal control over her own life. In this sense, the rituals were being performed instead of either the more socially acceptable religious activities that she had employed as a child or the more effective social skills that she had apparently never developed. For example, she was unassertive in her relationship with Tony. Instead of standing up for her rights, she would meekly acquiesce to even his most unreasonable demands. At the same time, she would become extremely frustrated and angry with him and would look for subtle ways to even the score. She was similarly unable to convey her appreciation to him on those, admittedly rare, occasions when he did please her. Treatment was therefore initially aimed at the development of interpersonal skills that would give Karen more control over her environment. It was hoped that as she was able to create a more satisfactory relationship with her husband and children, her increased competence would eliminate the necessity of turning to admittedly superstitious, ineffective attempts to achieve self-control. Karen quickly recognized her deficiency in this regard but was unable to change her behavior spontaneously. She and the therapist therefore agreed to pursue a systematic program of assertion training. The initial sessions in this sequence were devoted to a careful assessment of the situations in which Karen was unassertive. She was asked to keep a daily notebook of such situations, in which she noted the people involved, the nature of their interaction, and her perception of the situation, including what she thought would happen if she did behave assertively. Having identified typical problem situations, Karen and her therapist role-played several incidents as a way of introducing Karen to more appropriate responses. They also discussed Karen's irrational fears associated with assertion. These thoughts centered on her implicit belief that everyone should love her, and that if she stood up for her own rights, people would reject her. These irrational self-statements were inhibiting the expression of assertive behaviors. After Karen became proficient with such exercises in the therapy sessions, she was asked to start practicing her new skills in real-life situations outside the clinic. After assertion training had produced some positive results, the therapist began teaching Karen more effective child management skills. These were based primarily on procedures associated with instrumental learning, also known as operant conditioning. She was taught, for example, to ignore her daughters when they were quarreling and to reinforce them positively for playing together appropriately. Her efforts were initially channeled toward behaviors that could be changed easily. The most difficult problems, such as getting the children to stop fighting at mealtimes, were left until Karen had mastered some of the general principles of child management. In addition to these skill training programs, the therapist also discussed Karen's concerns about religion. It was clear that the church was still important to her and that she experienced considerable guilt and anxiety over her failure to attend services regularly. The fact that her children were not involved in church activities was also troubling to Karen. She worried that if any harm came to one of them, God would not protect them. For these reasons, Karen was encouraged to visit several priests at churches in her area in an effort to find one who was more conservative and thus more compatible with her own views. Although most of the local priests had moved toward contemporary practices in their own churches, they did refer her to an older priest at a church somewhat farther from her neighborhood, who still adhered to several of the traditional rituals she had learned as a child. She made an appointment to visit this priest and was both pleased and relieved after their initial meeting. He was able to discuss with her some of the changes that had been made in the church. In some cases, he was able to explain the rationale behind a particular change in a way that was acceptable to her. This process was, no doubt, facilitated by the fact that he shared many of her concerns about abandoning traditional practices. Karen felt much more comfortable with this priest than she did with the liberal priest who was in charge of the church in her immediate neighborhood. Within weeks, she was once again attending church regularly with her 4 children. The combination of assertion training, parent education, and a renewed interest in church activities did lead to an important improvement in Karen's mood. After 3 months of treatment, she reported an increased sense of self-confidence and an improvement in her family life. There was also some reduction in her anxiety level. She continued to observe her number rituals, but they were somewhat less frequent, and when she did fail to perform the counting routines, she was not as distraught as she had been at the beginning of treatment. At this point, Karen's rituals were addressed directly using a behavioral treatment method known as exposure and response prevention, ERP. This procedure involves purposely exposing the person to stimuli that provoke intense anxiety, either in imagination or in reality, for extended periods of time while preventing the person from performing anxiety-reducing rituals. Karen was asked to smoke a single cigarette at the beginning of a therapy session. When she was finished with a cigarette, she began to feel anxious and worry about her oldest daughter. She was then instructed to resist the temptation to smoke another cigarette. Thus, the response that she typically employed to neutralize her anxiety and to control the ruminations was prevented. The therapist believed that this type of prolonged exposure to the anxiety-provoking situation would lead to a reduction in Karen's anxiety. The procedure was carried out during 4 consecutive 2-hour sessions. Karen was encouraged to practice the same response prevention procedure on her own between sessions. When she had mastered the cigarette smoking problem, the procedure was extended progressively to other similar situations in which she had been concerned about numbers. Treatment was terminated after 20 sessions. Karen was no longer depressed and had not engaged in her compulsive counting rituals for 4 weeks. The children were better behaved at home, and Karen had plans to institute further changes in this regard. Her relationship with Tony was somewhat improved. Although he had become quite upset initially when Karen began to assert herself, he became more cooperative when he saw an improvement in her adjustment. In the next chapter we discuss the medical aspect of the case in details. Check it out in the cards.